Aya, Piri Wingswioni, Ni'ila Pewalia. Hello everyone, my name is Piri and I'm Peoria. Welcome to our first Off the Rez Podcast, episode 1. I'm glad you're here, and I'm going to keep tonight brief. This space where we talk about tribal public health, culture, and community with honesty, clarity, and no filters. You'll see I'm super laid back, but I'm passionate. I am recording from my home, and you might often hear my dogs barking, or as in the case tonight, snoring. I'm a night owl, and I will probably record during the late night hours. So why did I choose tribal public health or Indigenous health? Both terms I will use interchangeably. I chose those because too often our stories get overlooked, misunderstood, or told by people who've never lived them. But here, we're going to do things differently. We're going to keep it rooted in facts, guided by data, and backed by lived experience. Our mission is to reclaim knowledge, strengthen our roots, and reconnect our people through storytelling that actually matters. This isn't just a podcast. It's about our health, our communities, and our future. And those things are too important to stay silent about. So what can you expect? Well, on this show, we'll unpack real issues, talk through real experiences, and bring honest conversations to the table, whether it's just me or voices from the community. So wherever you're listening from, thank you so much for being here. And before we get too far into things, I want to take a moment to introduce myself and share a little bit about where I come from and why this work matters to me. As I said, my name is Piri, and I am a member of the Peoria tribe of Indians of Oklahoma. And a few years ago, I moved back to Oklahoma to be close to family. My work, and honestly my life's passion, has been rooted in community, in our people, and in telling stories that don't always get told the way they should. I earned my bachelor's degree in medical anthropology from the Cal State University, San Marcos. And then I went on and earned my master's of public health in epidemiology and health behavior from the University of California, San Diego School of Medicine. I am proud to announce that I am currently working towards my PhD in Indigenous health from the University of North Dakota School of Medicine, where I recently passed my comprehensive exam, so I'm officially a PhD candidate. And my focus is on building health systems that actually reflect and respect our community priorities. Over the years, I've worked across tribal, state, and academic systems as an epidemiologist, a public health leader, and an educator. I've supported dozens of tribal nations with data, program planning, and health strategies. I've led large-scale public health initiatives, and I've worked on the ground during major public health responses, including being the lead tribal outbreak investigator and tribal liaison serving tribal communities in San Diego County during COVID-19. I have also had the opportunity to teach public health, lead research, and work internationally in Indigenous health spaces. From Uganda, Africa, to New Zealand. Right now, I am currently the CEO and founder of Strengthening Native Connections, where I focus on tribal public health consulting. I help build programs, translate data into action, and support communities in ways that are actually meaningful and sustainable. I'm also proud to announce that just last week, I founded my nonprofit, which is called Strengthening Native Roots, and I'm proud to announce that to you. But more than any title or degree, what matters is this. I've seen firsthand how healthcare systems and Indian health service have failed our communities. I've seen data get ignored and often erased, while stories are left untold and decisions get made without us as Indigenous peoples being at the table. And that's why this podcast exists. Off the Rez Podcast is my way, or our way, of taking that space back to talk about what's really happening, to break things down clearly, and to make sure our voices, our knowledge, and our lived experiences are part of the conversation. So now that you know a little bit about me, let's get into today's conversation. And again, I'm going to keep tonight brief. So what is tribal public health and why does it matter so much? When people hear public health, they usually think about hospitals and maybe doctors or maybe disease. If you're like me, I didn't know about public health until I started college. But public health is so much bigger than just those few terms. It's everything that shapes how we live. It's education, it's economics, it's housing, food access, policy, culture, identity, and of course, chronic and infectious disease. It's whether or not our communities have the resources to thrive, not just survive. And when we talk about tribal public health, we're talking about all of that through the lens of tribal sovereignty, data sovereignty, history, treaties, and lived experiences. We're talking about communities that have been systemically underfunded and overlooked and often left out of the decisions that directly impact our lives. Tribal public health matters because outcomes don't exist in a vacuum. They're shaped by generations, by policies, by displacement, by resilience, and by strength. And if we don't understand that full picture, we can't fix what's broken. This podcast exists to break that down, to make public health real, not just statistics, not just reports, but real life. I want to connect the data with the stories because both matter. And I also want to talk about the name of the show, Off the Rez. For some people, that phrase has been used in a negative way. It's been used to stereotype, to separate, or to label our people in ways that don't reflect who we actually are. And now that I brought it up, you'll probably hear it on TV or in movies to reference someone who's probably not Indigenous or as having gone crazy. But this podcast is about taking our language back, reclaiming it, redefining it, turning something that may have been used against us into something that belongs to us. We've seen this before. I'm sure you've heard phrases like low man on the totem pole, or let's have a powwow, or circle the wagons, all of which have been misunderstood and misused. When in reality, these terms carry deep cultural meanings. Across this country, Indigenous names have been used for military equipment or mascots or brands, often without context, without permission, and without understanding. So Off the Rez, in this space, isn't about separation. It's about perspective. It's about speaking freely, thinking critically, and creating a space where our voices don't have to be filtered to be heard. I also want to point out that off the res can also be interpreted as those of us who live off the reservation or who have never gone back to their reservation to create an inclusive space for you too. If you're like me, I don't live on a reservation and I never have. But off the res, I want everyone to feel included here and to let you know that you're actually the majority if you are a member of a tribe, because statistics show that over 72% of tribal members do not live on their tribe's reservation, if their tribe even has one. So Off the Rez podcast is for all Indigenous people, an inclusive space. This isn't just my space, this is our space. I want this podcast to grow with the community. So if there's topics you want me to cover or questions that you have been carrying or conversations you feel like no one is having, I want to hear from you. Drop a comment, send me an email. Please reach out however you feel comfortable. And if you are Indigenous, especially connect. We've got to support each other, share ideas, build community, because that's how we move forward. So, in closing, in the end, tribal public health is about more than just healthcare systems. It's about Indigenous people, our communities, our tribes, and our relations. It's about us. At the heart of this podcast, we must respect tribal sovereignty and be part of the conversation to determine our own health outcomes. So let's keep talking. Thank you for listening, and I look forward to recording our next episode. Until then, sending love, light, and healing to all my Native relatives. Nishinaway.